Hello, my name is Jasmine Johnson. Today is April 2nd, 2018, and today I'm going to go over the lymphatic system and the important lymphatic organs, and also how the lymphatic system works. So first I want to show you a visual aid of the different organs in the lymphatic system. So first I'm going to show you where the tonsils are. The tonsils are actually located in the back of our throats. We all kind of know where the tonsils are. We're familiar with that. And then the cervical lymph nodes. Those are located right here deep in the neck. So where the cervical lymph nodes are. Sometimes a physician will palpate those areas to see if they're swollen. They will sometimes palpate the cervical lymph nodes. The thymus. The thymus is located above the heart. It's right there in the middle of the chest area. And then the axillary nodes. The axillary nodes are underneath the armpits. So where the axillary nodes are located. The spleen is on the upper left-hand corner of the abdomen area. Where the spleen would be located. And the Peyer's patches would be located within the small intestines. And the appendix is at the bottom right side of the abdomen. And that is where the appendix area will be located. So hopefully that's a good visual aid for you to see where the different lymph node organs are located. I also created a flow chart. The flow chart kind of basically is another visual aid to just kind of show you how the cycle of the lymph node fluid goes throughout the system. So first it starts with the blood capillaries. From the blood capillaries, it goes into the interstitial space, which actually creates the interstitial fluid within that interstitial space. From there, it goes to the lymphatic capillaries, and then to the lymphatic vessels. Then from there to the lymphatic nodes, and then back to the lymphatic vessels. Then from there, the lymphatic ducts, and then to the junction of the internal jugular and subclavian veins, and back to the blood capillaries. So it kind of goes within this circular motion. One of the things that's different about the lymphatic system is it's not pumped by something like the heart is when it pumps through our circulatory system. It's more so actually pumped or moved, if you will, by your muscle contraction and by breathing, and then it basically goes back into that circulatory system. So the lymphatic system is a system of vessels, cells, and organs that are carried through excess fluid to the bloodstream and filters pathogens from the blood. One of the major functions of the lymphatic system is it drains fluid and it returns them back to the bloodstream. Blood pressure causes the leakage of the fluid from the capillaries. This makes an accumulation of fluids in the interstitial space, that is the space in between individual cells in the tissues. In a human, 20 liters of plasma is released into the interstitial space of the tissue each day due to capillary filtration. Once this is filtered out of the bloodstream and in the tissue space, it is referred to as interstitial fluid. 17 liters is reabsorbed directly back into the blood, but the other 3 liters are drained. The excess fluid empties back into the bloodstream through a series of vessels, trunks, and ducts. Lymph is the term used to describe interstitial fluid once it has entered into the lymph system. The lymph system is not actively pumped by the heart, but forced through the vessels by the movement of the body, the contraction of the muscles there in the body movement, and the breathing. The lymph node system has the one-way valve, which is the semilunar valve that keeps the lymphs moving towards the heart. Lymph flows from the lymphatic capillaries through the lymphatic vessels, and then it is dumped into the capillary system via the lymphatic ducts, located at the junction of the jugular and subclavian veins of the neck. So, hopefully you learned something from my video. Thank you so much, and you have a blessed night.